Thank you very much, Bill. So, yes, we do have a lot of questions for you. So, yeah, here. So, what is the efficiency of portable air cleaner to remove thrush in the classroom? Do you have standards for that or certification?
Well, those are typically, if they're rated devices, they're selected for their clean air delivery rate. So there's an association of home appliance manufacturers that has a test procedure for portable air cleaners for particulate matter, at least, and so we're applying that clean air delivery rate to the classroom, and so that's the efficiency. How much do you need depends again on what your ventilation and filtration of existing systems gets you to, and it needs to be supplemented. So some may have seen there's a Harvard University of Colorado calculator for schools that helps you do just that. You enter information about the ventilation and filtration that you already have, and it will help determine how much air cleaner capacity is needed to get to a target of, say, 5 or 6 air changes per hour equivalent total.
Okay. Question about UV. So we are seeing UV system being installed, but mainly a single tube UV system for coils or for duct. Does ASHRAE have guidelines on minimum install of UV to include FPM exposure to protect user and poorly done installs?
Yeah, that's an interesting question, and it was mentioned in the U.S. UV has gotten a lot more use and interest for a long time. ASHRAE actually has a technical committee on UV. We wouldn't view it as a question of how many lamps do you need. We have a dose response model for exposure to germicidal light, and so what you do is working with that exponential disinfection relation and knowing the rate constant of the microorganism, its susceptibility to UV, and the time of exposure that's available or desired, we can determine what the irradiance or fluence needs to be, and then when you have that dose specified, a configuration of lamps can be developed that will deliver it. So we don't think in terms of something as simple as you need 1 lamp or 2 lamps. That actually needs to be worked out, I think, with the manufacturer based on the characteristics of their sources. And there are guidelines, general guidelines for installing. There's a good ASHRAE journal article on best practices that you might take a look at. Okay,
thank you. How is the ASHRAE standard 62.1? So what is the, flow rate per person per second normally?
Standards for non-healthcare are an interesting topic. ASHRAE standard 62.1 has the goal of no harmful concentrations of contaminants as established by cognizant authorities, and 80% of those exposed do not express dissatisfaction. So it basically goes back to, for example, Fanger's experiments on ventilation rate and satisfaction level, and of course that gets us to about 7 liters per second per person for 20% dissatisfaction, which works out to about 15 CFM per person in our obsolete U.S. unit system.
Okay. So the HVAC industry historically does not sell filters, and many systems cannot be sealed due to track design. What is ASHRAE stand on sealing the higher efficiency MERV certain filter when folks do not seal or the system cannot be sealed?
Yes, that's certainly something that we're aware of and concerned about. And if you go into the detailed guidance, we do discuss taking steps to avoid bypass of filters, for example, by taping over the gaps between them.
Okay, thank you. We'll take one last question. I'm sorry for all the others. So, if filtration is not 100% on fresh air, does the virus-free air is 100%, in SARS-CoV-2 free air is 100% effective? Then with a plate-type energy recovery technology, less than 0.1% of zero cross-contamination, not an option. Energy recovery will negate energy penalty?
Oh, well, as I mentioned briefly, we're all in favor of using energy recovery that doesn't result in unacceptable levels of reentry. As some on our task force have pointed out, it's impossible in a lot of cases to limit reentrainment to zero, even from, say, exhausts on the outside of the building into outdoor air intakes. The goal is to have it be low enough that it's not a concern. So we certainly support energy recovery as a way of reducing the impact of ventilation, but it's still significant even with good energy recovery.
Okay, thank you. So, well, we will try to come back to the next question at the end.